This video is intended to be a supplement to the MDH full hearing screening training. It is highly recommended that you complete the MDH training. MDH provides the best practice recommendations for screening. This video will review pure tone audiometry hearing screening for children ages 3 to 20. After the video, the learner will be able to perform pure tone audiometry hearing screening, will understand how to plan for screening, and how to train volunteers. The purpose is to identify children with a hearing concern by presenting a series of set decibels and hertz pure tones using pure tone audiometry. This is the equipment you will use for screening. There are many different kinds of audiometers, so it is important that you familiarize yourself with the one you will be using once you get to the screening day. Screening setup. Make sure to check with the school secretary or front office staff before scheduling your mass screening to make sure there are no field trips, standardized testing, school events, etc. Make sure you communicate the date to all staff once it is set so that they can block it off on their calendars. You may also put a notice in the school newsletter alerting parents. Front office staff can also be helpful in finding and reserving space for screening. Many tools can be found in the MDH Hearing Manual. Examples include, but are not limited to, the School Hearing Screening Worksheet and the Hearing Referral Letter, as well as the written procedure for pure tone audiometry screening. You will also need to know who needs to be screened. This chart shows which grades need hearing and vision screening according to MDH. As you can see, students in grades K, 1, 2, 3, 5, 8, and 11 need hearing screenings. Volunteers. To find volunteers, partner with your local nursing programs, connect with other school staff members to help recruit parent volunteers, or connect with local community organizations. Make sure you know what your school requirements are for volunteers. Ideally, volunteers would complete training through MDH Child and Teen Checkups, review the MDH Hearing Manual link, or you as the nurse would train. The accompanying volunteer video is intended to be a refresher, not the sole training for volunteers. On the day of screening, you should plan for at least 1 hour of training and practice prior to the actual screening if volunteers have not previously been trained. Environmental setup. The space you choose for screening needs to be quiet and free of distractions. Screening next to the cafeteria, gym, or the doors that lead to the playground is not ideal, so try and find a small room away from those areas and perform an environmental noise check. Have enough room so that the screener can sit out of the student's line of sight to prevent visual cues during the screening. Please refer to the MDH Hearing Manual for more information. Make sure that everything is in working order. Your machine should be plugged in and the sound set to pulse. For best results and the least amount of rescreens, perform an environmental noise level check. Refer to the MDH Hearing Manual for more information about performing an environmental noise level check. Consider if you will do rescreens immediately or on another day. You will need to set up another screening station for rescreens if you are doing it on the same day. Immediate rescreens cut down on referrals and create less work in the long run. Classroom pre-teaching. We have also created a classroom pre-teaching video that teachers may use to prepare their students for screening. Step 1. Get to know your equipment. You may already be familiar with audiometers. They come with headphones that are designated red right or blue left. Remember, the red is always on the right ear, red for right. Make sure that they are plugged in correctly with the red cord going into the red port and the blue cord going into the blue port. You can also see that there are dials to change the hertz and decibels and a button for presenting the tone. We will review how to present tones later, but for now, make sure you can see which dial is for hertz, which is for decibels, and where the button is to present the tone. It's a good idea to put the headphones on and listen to the tones so you know how they sound. Step 2. Setup for screening. Make sure the student is seated so they cannot see the audiometer or screener pressing buttons. The environment should be as noise-free as possible. Explain to the student what you are going to be doing. The examiner can say, "We're going to put on these headphones and you're going to hear some beeps. Some are very soft, while other beeps are louder. That's why it is important to listen carefully. Every time you hear a beep, raise either hand. Put your hand down when you no longer hear the beep. Remember, this is not a test. Just show me what you can hear." Before placing headphones on the student, lay the headphones on the table and set the audiometer at maximum decibel of 80 and hertz at 2000 and have the student practice raising their hand so they may demonstrate understanding of what action to perform when they hear a tone presented. Make sure to remind them to put their hand down when they no longer hear the tone. If at any point the child does not understand the instructions, please stop, take off the headphones, and re-instruct the child. If you are screening a very young child, as in under age 5, or a child who is unable to raise their hand, you may need to use play audiometry for the screening. More information on this can be found in the MDH Hearing Manual. Step 3. Performing screening. When placing the headphones on the student, proper fit is critical for an accurate result. You want to ensure the headphones fit snugly on the child's head. Remove glasses, headbands, large earrings, etc. Also, if a student has a lot of hair, make sure it is pulled back and not under the earpieces. It is important for the center of the headphone to be placed directly over the opening of the ear canal. Place the red headphone on the child's right ear and the blue headphone on the left ear. Always start with a frequency of 1000 Hz, 40 decibels in the right ear once the headphones are on. This is considered a practice tone. The examiner can say before starting, "We will start with a louder beep to make sure you know what it sounds like." After they raise their hand, the examiner can say, "Good job. Now I'll do the rest of the screening without talking, but keep raising your hand when you hear the beep." Continue on with the screening tones. Starting with the right ear, turn the dial to 20 decibels and present tones at 1000, 2000, and 4000 Hz. For students 11 and older, they should be screened at 6000 Hz as well. Present tones for 1 to 2 seconds and vary the pace that you deliver the tones. Avoid a consistent rhythm so students can't anticipate when the next tone will be played. You may present each tone twice consecutively if needed for each screening frequency. Switch to the left ear. Keep the dial at 20 decibels and present tones at 6000 for students greater than 11 years old, 4000, 2000, and 1000 Hz. While you're still on the left ear, set the dial to 25 decibels and present the tone at 500 Hz. Then, turn the selector switch to right and present the same tone. If the student hears all the tones, they have passed. You just need to document the screening results. The examiner can say, "We're finished. You did a great job." Record the results of the screening when the screening is complete. Pass or refer. Here's an example of a reference guide for performing the hearing screening for children 11 years and older. Remember, a practice tone of 40 decibels and 1000 Hz should be presented before starting the screen to confirm each student understands the directions given during conditioning. Step 4. Record results. Record the results of the screening when screening is complete. If the student is unable to hear some tones, this does not necessarily mean the student has a true hearing concern. They could have fluid or a lot of wax in their ears at the time of the screening. Here is an example of what your recording sheet may look like. In this example, the student was unable to hear 3 of the 4 tones in their left ear. The check mark means they heard the tone, and the circle with the line through it means they did not hear the tone. If the initial screening is failed, then it is recommended that an immediate rescreen be performed with a different screener and different audiometer. This is why it's important to decide prior to screening if you will have a station set up for immediate rescreens. This is best practice and will save you time if you are able to rescreen immediately. This is an example of documentation of an initial and rescreen done on the same day. Perform the screening a second time and record results as shown in this example. This way it is clear that a rescreen has been performed on the same day. Here is the referral criteria. If the child does not respond to one or more sounds on the immediate rescreen, schedule the child for pure tone audiometry rescreening in 14 to 21 days. During this follow-up screening, 14 to 21 days later, conduct a screen. If they pass and no further follow-up is needed. If they do not pass, conduct an immediate rescreen. If they do not pass this, refer to their primary care provider, noting that this child has not passed 4 hearing screenings. Always follow the referral criteria and use your nursing judgment when deciding to refer a student. If you are unsure, refer to their primary care provider. Always refer back to the MDH Hearing Manual for more information. In summary, follow the steps we reviewed. Before the screening day, find a date that works for your school and find your volunteers. Find where you're going to screen and think about what you're going to do about rescreens. Have a separate station for immediate rescreens or do them another day. On the day of screening, check your equipment and set up the environment for screening. Meet with your volunteers to provide training and answer questions. Perform the screening, record the results, and refer as appropriate. The MDH Hearing Manual is your best resource for further questions, information, and resources. Also, if you haven't taken the Child and Teen Checkups training or haven't taken it within the last 5 years, please make time to do so. Thank you so much for watching. More information can always be found in the MDH Hearing Manual, which includes but is not limited to risk assessment questionnaires, referral letters, written procedures, etc. This training video is made possible through COVID-19 Public Health Workforce Supplemental Funding from the Centers for Disease Control and Prevention, administered by the Minnesota Department of Health in collaboration with Brightworks.